Hello, I'm Professor Russell Barkley, and I work in the Department of Psychiatry here at Virginia Commonwealth University School of Medicine in Richmond, Virginia. In this lecture, I'd like to speak with you about the evidence we have for possible sex differences in adult ADHD. What do these mean for understanding, diagnosis, the nature of ADHD, and for managing this particular disorder? Understand that the disorder itself and its major symptoms are virtually the same in both sexes. There are deficits in two domains of neuropsychological development. The first of these is in hyperactive and impulsive behavior, or what I like to think of as executive inhibition, and the layman might call simply self-control or inhibition. The problems with inhibition are seen across at least 5 different domains of psychological functioning. The first and most obvious, particularly in boys, is the development of hyperactive motor behavior. This is a sign of reduced inhibition in the motor control executed by the brain. And it appears that boys, particularly in the preschool years, may be somewhat more likely to show this pattern of motor behavior, though I want to emphasize that, as in many other areas we'll talk about in this lecture, where differences are found, they are relatively small. Instead, girls are more likely to show excessive talking or verbal behavior. Again, it's not that the boys don't show this, they do as well. But there might be a slightly greater likelihood of seeing these symptoms in girls. The remaining 3 problems with inhibition are similar in both sexes. There is what I call cognitive impulsiveness, and that is difficulties with controlling and organizing one's thinking very impulsively, finding one's thoughts to be interrupted by other irrelevant thoughts more easily. The individual doesn't deliberate their thoughts for very long and often makes very rapid or impulsive decisions based on these thoughts. So there's an overall disorganization and lack of self-regulation in the thought process itself. We also see impulsive motivation in both sexes, which is to say that both of them show an equal penchant for immediate gratification. That is, opting to do things now that provide more pleasure, enjoyment, or small rewards in the moment, rather than pursuing later consequences, or what you would call deferred gratification. So with people with ADHD of both sexes, we see that they steeply discount the value of delayed rewards and outcomes, preferring to choose more immediate gratification. There's also an emotional dysregulation or poor self-control of emotion seen in ADHD. So there's a lot more impulsive expression of emotion in both sexes that have ADHD. This may be slightly different between males and females because we know that the emotional tenor and the emotional expression of males and females in the general population can be somewhat different, with males being somewhat more prone to aggressive and violent emotions, for instance, whereas females might be, especially by adulthood, more prone to anxiety and perhaps depression. But again, both groups of adults, that is, both sexes, show this problem with impulsive emotion and difficulties with the self-regulation of strong emotion once it has been provoked. Now, the motor activity declines with age, particularly through adolescence, and may become more internalized or subjective. And both sexes have reported this change, but it may be, as I've said, somewhat more likely to occur in males than females because there's some evidence to suggest, as I noted earlier, that boys may be more motorically active than girls, and girls could be more talkative and verbally active than boys. But again, the differences where found are small, and both show the same developmental changes in this dimension. That is, a decline in the overall level of hyperactivity and an increase in difficulties with emotion regulation. Now, it may be that the emotion regulation isn't increasing so much as the fact that as children get older, we expect them to show more control over their emotions. And children and adults of both sexes may have difficulties with this and thus become more evident in their poor emotion regulation with age. Now, both sexes also have difficulties with the inattention dimension of ADHD, or what in my other lectures I've referred to as executive functioning. We'll talk more about that term in just a moment. We know that there are at least 5 or 6 kinds of attention mediated by the human brain, such as arousal, alertness, the focus of one's attention, how quickly we orient to new events in the environment. But only one of these appears to be primarily impaired in ADHD, and that is what lay people call sustained attention, but what I think of as attention to the future, the ability to propose a goal or to have a goal assigned to you and to be able to string together long, complex chains of actions to accomplish the goal. So, we posit a now, we think about a future, a goal, and we go about constructing ways to achieve that goal. This is much more common in humans than in any other species. Humans pay attention to possible or probable futures. And we find that this impairment in sustained attention and persistence, or what I've called attention to the future, is equally as problematic in both sexes of children and adults. Now, what do we see in this dimension in terms of specific problems? Well, the individual is less able to persist toward tasks, goals, and accomplishing and preparing for the future more generally. We often say they simply can't sustain attention well over time, but it's really sustaining persistence of action that is the problem here. Second, they have difficulties with inhibiting responding to distracting events. People with ADHD don't perceive those events any more than others. They are much more likely, however, to react to them when they occur. So life is filled with a lot of events that aren't relevant to the goals that we're pursuing, and people with ADHD have more difficulty suppressing reacting to these goal-irrelevant events than do others. And these events can be not only external distractions, but internal ones as well, such as might occur with mind-wandering or daydreaming. Now, we all are interrupted periodically in our goal pursuit, and we have to stop what we're doing and deal with those interruptions. But typical people are likely to come back and finish the incompleted work or goal. People with ADHD are a lot less likely to re-engage a former task when they're interrupted, and therefore they go skipping across many other activities once they have been distracted from a task or a goal. Both sexes also show gross impairments in working memory. Working memory is holding mental information actively in mind that is guiding us toward our goals, toward what we hope to do. And people with ADHD have difficulty with that. Now, this kind of memory is called working memory, remembering what we're doing. And this is where we see the forgetfulness in daily activities, so commonplace in children and adults with ADHD, and equally as common in both sexes. Both of them have difficulties with remembering what they're doing, and if they're interrupted, are a lot less likely to re-engage the incompleted goal. Now, both sexes also have difficulties with self-awareness, or attending and monitoring one's own behavior. So there's very little differences then that we see between the sexes in the overall basic types of symptoms that we associate with ADHD: hyperactive and impulsive behavior, and inattention and poor executive functioning, particularly working memory. Now, I've just described for you 6 of the 7 major executive functions that occur and are fully developed in typical people by the time they're adults. And both sexes have these executive functions. There are little or no differences found in them, and the same is true in adults with ADHD. Both show executive deficits. Now, at the bottom of the screen, you will see what I consider to be the 4 primary executive functions, or level 1 functions, that develop in early to middle childhood, may take a decade or longer to reach their full level of functioning. And these 4 basic executive functions will give rise to the next 3 that occur in development. And that is emotional self-control, self-motivation, and planning and problem solving. And you can see in parentheses that I have reframed all of these as actions to ourselves, because I believe that that's what defines an executive function. In my theory of executive functioning, I have argued that the executive functions are things we do to ourselves to change our behavior in order to make a future event or consequence more or less likely to occur. And therefore, each of these 7 is a type of self-regulation or self-modification. You put them all together, and the individual has a suite of mind tools for self-regulation by adulthood. The bottom 4 are primary because I think those are the ones that allow us to get the last 3 at level 2. But no matter, the point we want to make here is that we can establish no sex differences in these executive functioning deficits in children or adults with ADHD. Now, this explains why people with ADHD often make very poor life choices throughout their daily lives and their weekly activities, and both sexes are equally prone to making such bad or poor or impulsive life choices. It may be that they do this in somewhat different domains, because each of the sexes may differ in the roles they opt into and the environmental niches they choose to participate in. But overall, we will see a pattern of impulsive choice-making in children and adults with ADHD. So to review then, ADHD in both sexes is more than just a problem with attention or even with hyperactivity and inhibition. It's a disorder of self-regulation. And that disorder arises from impairments in the 7 major executive functions, which are equally as likely in both sexes. This self-regulation allows us to anticipate the future, begin to reflect upon it, and then prepare behavior in advance of the arrival of these future events. It allows us to show intentional behavior. The word intentional means future directed. We have intentions that we hope to accomplish. So ADHD could be said to be, quite simply, intention deficit disorder, more than it is attention deficit disorder. And again, there's no differences in the sexes in the nature of these problems. Therefore, ADHD is disrupting the cross-temporal organization of behavior over time in order to accomplish goals and to optimize our future longer-term consequences, essentially to see to our general welfare. Instead, people with ADHD are choosing to opt out of such deferred gratification and instead opt for more immediate gratification. As a result, this explains why we see such a negative association between ADHD and pursuing delayed gratification, as in attaining lots of education, preparing for the future, saving for our future, if not for our retirement. Self-regulation is also associated with the personality trait called conscientiousness. In essence, they almost mean the same thing. People who are highly conscientious show a great deal of self-regulation, forethought, preparation for the future, and contemplation of the consequences of their actions. And people with ADHD are a lot less likely to show these things, and they're often very low in this trait of personality called conscientiousness. And again, there are no gender differences, that is, sex differences, in these deficits. So hundreds of times each day or each week, we all have to make choices. And to do so, we use self-regulation, because the choices we have to make are between immediate consequences for doing one thing and delayed consequences for what we might choose to do. And typical people, especially as they mature into adulthood, are more likely to opt for the longer-term consequences and to act accordingly, whereas people with ADHD don't, and therefore appear to be making very immature life choices, those more typical of children, teens, and even young adults, where they're opting for more immediate gratification than later gratification. So ADHD strongly biases their decision-making in both sexes to making choices in these choice scenarios toward optimizing the moment rather than optimizing their future. And over time, these constantly impulsive decisions are going to have a cumulative impact on their longer-term outcomes in terms of their health, education, social functioning, and many other domains of life I'll talk about here. Also, this impulsiveness creates a higher risk for accidental injury, for suicide, and even for self-harm, such as self-cutting, which may be something we see more in females with ADHD than males. Again, I'll have more to say about that shortly. But the point is, both sexes of adults with ADHD show this pattern of impulsive choice-making and decision-making, and therefore both of them are predisposed to numerous adverse consequences across virtually every major domain of life that we have studied to date. Now, these sex differences, which begin in childhood and certainly become evident by adolescence, right, often foretell the kinds of sex differences we might see in adulthood. So, for instance, in adults, there's very few, if any, differences between the sexes in their primary ADHD symptoms and in their executive functioning deficits. So let's understand that the disorder is the same in both sexes, and so there's no need for new or different or qualitatively unique symptoms and diagnostic criteria for use with women than we would use with men. The diagnostic criteria and our understanding of the nature of ADHD appears to be equally as likely applied to both sexes. Now, we do see some inconsistent evidence that girls might be somewhat less motorically hyperactive, even if they might be somewhat more verbally hyperactive. But overall, there are no differences in the three presentations of ADHD, the combined, the hyperactive, and the inattentive presentations, what we used to call subtypes of ADHD. So no evidence there that one sex by adulthood is likely to have one presentation or subtype any more than the others. Although I've heard clinicians say they think that the women may be more prone to the inattentive presentation. Research just doesn't bear that out. But assuming that girls may be somewhat less motorically hyperactive, and therefore their problems are going to be primarily in the inattentive and executive functioning domain, then it might take a little longer for girls to be identified as having ADHD, because you see the hyperactive, particularly the motor hyperactivity, begins first in childhood, to be followed later within 2 to 4 years by the inattention and the broader domain of executive functioning deficits. So assuming that there might be some slight differences in hyperactivity could explain why girls might come to our attention somewhat later in childhood than boys. But again, I want to emphasize that any sex differences that have been found in children, just like those in adults, are very small. Now, in childhood, there's definitely a bias in more boys having ADHD than girls. The ratio is somewhere between 2 to 1 to 3 to 1 in childhood. And part of that could be that boys are simply more prone to various neurodevelopmental disorders, such as autism spectrum disorder and the learning disorders. But it could also be the result of the fact that the DSM criteria have a lot of symptoms of motor hyperactivity, at least 6 of them, and only 3 symptoms of verbal impulsivity. That being the case, if boys show more motor hyperactivity than girls, then boys might be more likely to meet the DSM criteria for a diagnosis of ADHD in childhood, at least until the girls catch up with the boys later in childhood. And that's because, again, the hyperactive symptoms may decline to the point where they're not as prominent in the boys. And both now are showing serious problems with self-regulation and executive functioning. So, as the hyperactivity declines with age, we see that the sex ratio is declining with age. Again, perhaps this is due to declines in motor activity. It could also be due to the increasing importance of executive functioning and self-regulation in life. The older we get, the more self-regulation we're expected to demonstrate. And since boys and girls show equal levels of executive functioning deficits, eventually the girls become as impaired and as identifiable as the boys. So in adolescence, the sex ratio is below 2 to 1, males to females. And by adulthood, this ratio has declined even further to about 1.5 to 1, if that. Indeed, many studies of adults with ADHD, particularly in community or general population samples, find that there are almost no gender differences now by adulthood. That is, that women are as equally as likely to be diagnosed with ADHD as men. Now, that said, I do want to mention some very recent research that is beginning to look at the effects of female hormones and their fluctuations over time, and how these might adversely affect ADHD symptoms. Because at least one study suggests that girls with ADHD may show 2 different ages of onset, rather than in males we see the onset mainly toward childhood and to some extent in adolescence. In girls, there's a group with a childhood onset, but there seems to be a second group that becomes clinically identifiable or significant right around the start of puberty, when they start their menses. And here we see that females may have more of an exacerbation of their ADHD symptoms, particularly their emotional dysregulation, as a result of these fluctuating hormones and the balance between estrogen and progesterone that occurs throughout their monthly cycles, as well as later in life, such as during the postpartum period after childbirth and around perimenopause. So we have to acknowledge the possibility that females may be showing periods of exacerbation of their symptoms as a consequence of their monthly and lifelong changes in their female hormones. Now, the executive symptoms, as I've said, become more prominent, more numerous, and perhaps even more severe with development, and thus become much more impairing than the hyperactive symptoms were likely to do. And therefore, because girls show these executive deficits as much as boys, we begin to see that girls are becoming more and more symptomatic in their ADHD as these executive problems become more evident. Now, other sex differences that we see in childhood that might continue into adulthood is that girls in childhood, in some studies, have been found to be more impaired at lower levels of symptoms than boys are with their level of symptoms and impairment, which is to say that girls may start to show impairment with fewer ADHD symptoms, at least in childhood, compared to boys. Now, this may be differences in real sex differences between boys and girls, but let's also understand that there are differing social expectations for boys and girls. Boys are allowed to be a little more rough and tumble and active and even aggressive, whereas if a girl were to show that pattern of behavior, she might be judged to be much more deviant compared to other girls than would a boy showing such behavior. So it's possible that there are differences in social expectations for girls and boys that bring about this issue where girls may be more impaired with lower symptom levels. We also know that girls in general show lower levels of disruptive, rule-breaking, aggressive, and motorically active behavior than boys in the typical population of boys and girls. And therefore, any girl who shows that pattern of deviant, disruptive, or rule-breaking behavior may stand out much more from other girls than a boy would from other boys. This is why clinicians like myself have argued that at least in evaluating children and teens, we need to use ADHD rating scales that have separate norms for girls and boys. And when we fill them out and score them, we compare the girls to other girls to see how deviant they are, rather than just comparing them to general population norms. Because this is where we may see that even with lower severity ratings on the rating scale, the girl is equally as deviant as boys that have somewhat more severe symptoms on the rating scale. Now, it's also possible that girls become not only more symptomatic in their ADHD, but become more emotionally dysregulated around the time that their hormonal cycles are changing, such as during the onset of menses, each month just before their monthly periods begin, later in life after they have children, where some may be more prone to symptoms of postpartum depression. And finally, in later life, as women enter perimenopause, we may see again an adverse effect of hormonal changes on women's ADHD symptoms and executive functioning, and especially on emotion regulation. And that means that there's going to be some differences in how we manage women with ADHD in adulthood, because we're going to have to address these episodic fluctuations and exacerbations in symptoms and emotions around the time of these changes in female hormonal balances. Now, there's some evidence that girls are much more prone to binge eating pathology, impulsive eating, and possibly even to the disorder known as bulimia, which is a more extreme form of impulsive binge eating. But longitudinal studies suggest that this is more likely to occur in adolescence. But by adulthood, these differences between the sexes begin to decline. But possibly in the adolescent years, the girls are more prone to binge eating. As I will discuss later, both sexes are more prone to impulsive eating, obesity, to poor diet, to less exercise, and therefore to a growing risk of various adverse health consequences associated with those behaviors. Girls, it seems, particularly in adolescence, maybe in early adulthood, are more prone to intentional self-injury, such as self-harm and self-cutting, whereas the boys may be more prone to accidental injuries related to risk-taking behavior. Now, I want to emphasize that both sexes are prone to accidental injury across the lifespan. Both men and women with ADHD do engage in more impulsive behavior and therefore are more prone to accidental injury and accidental death. Where we may see some sex differences is in the risk for suicide attempts. Because there may be a slightly greater risk that females develop depression by adolescence or adulthood, we may see a greater increase in suicide attempts, because depression leads us to think about suicide, but the impulsivity seen in ADHD in both sexes may lead people to attempt suicide much more than would simply a depressed person who doesn't have ADHD and doesn't have that impulsivity. So there's some evidence of a greater risk of suicide in females with ADHD than males, but don't let that fool you. Both sexes are more likely to attempt suicide than are typical people of the same age. Now, with that discussion, let me move on to any possibility of sex differences in adulthood in comorbid, that is, coexisting psychiatric disorders. Those disorders that first appear and are very common in ADHD are what we think of as the externalizing or disruptive disorders. And they are oppositional defiant disorder, conduct disorder, which is a pattern of antisocial behavior and aggressiveness, and substance use disorders, which often link up with these other two disorders by adolescence and certainly by adulthood. Research shows that boys and even teens may be more prone to develop these disorders than girls, at least according to parent interviews about these disorders. However, I want to emphasize that even where these differences are found, they are small, meaning that even girls and women with ADHD are nearly as likely to develop these disorders as are males with ADHD, and both are more prone to do so, markedly more prone than the typical population. But we do have to acknowledge that some research does show a slight male bias for these disorders, particularly when interviewing others. But when we take direct measures of behavior in natural settings, these sex differences tend to disappear. Now, ADHD individuals do have a higher risk for major depression by adolescence, for mild depression called dysthymia by adolescence and adulthood, and for suicide by adolescence and adulthood. There is also another disorder that is characterized by more extremes of depression combined with very impulsive, destructive, and aggressive behavior and temper outbursts. And that disorder is called disruptive mood dysregulation disorder. It's not clear whether people with ADHD by adulthood are more prone to bipolar disorder. Some evidence suggests that they might be, perhaps 2 to 3 times more likely than typical people. Even then, however, the prevalence of bipolar disorder is quite low in people with ADHD in both sexes by adulthood, perhaps rising to about 6 or 8% of cases having bipolar disorder, whereas in the general population, the rate is around 1 to 2%, if that. Now, are there sex differences by adulthood in these disorders? Well, we do know that females may be more prone to suicide attempts by adolescence and adulthood, though as I've said, both sexes share that risk, but a slight bias toward females. Males may be more prone to the more aggressive, destructive, and violent mood disorder known as disruptive mood dysregulation disorder. And there may be a slight bias for females to develop more depression over time, but that is so inconsistent that I don't want to focus on that right now. Where we see a growing risk for sex differences by adulthood is in anxiety disorders. Over time, the longer that ADHD goes untreated, the greater the likelihood that an anxiety disorder is going to develop coexisting with it. And this is not only across childhood into adolescence, but seems to occur throughout adulthood as well. So, both groups of adults are prone to anxiety disorders, perhaps rising to the level of 35 to 50% of adults may have an anxiety disorder. But by adulthood and through adulthood, there's a growing difference that females may be even more likely to develop anxiety than males, though both show higher risk for anxiety than in typical adults. The tic disorders and Tourette syndrome are known to be much more common in males than females in the general population, and we see that difference somewhat in men and women with ADHD as well. But because tic disorders and Tourette syndrome are very uncommon in adults, these sex differences are relatively minor. There's a small amount of research that ADHD in childhood predisposes toward hoarding behavior specifically by adulthood, and more generally, obsessive compulsive behavior, if not obsessive compulsive disorder, but hoarding specifically. And of course, this appears to be much more problematic in females with ADHD than in males. Now, when we look at other neurodevelopmental disorders, such as autism spectrum disorder and intellectual disability, we know that these disorders tend to be more common in boys than in girls, and the same is true in men than women in the general population. So it's not surprising to see that when we look at differences between boys and girls with ADHD, we also see this male bias, and it continues into adulthood. But again, it's the same kind of male predominance that we would see in a typical non-ADHD population as well. The difficulties that occur in school around academic achievement, such as specific learning disabilities, or problems with motor development, such as motor coordination disorder, or language and communication disorders, are the same in boys and girls with ADHD, and therefore are also the same in men and women with ADHD. Where we might see some small sex differences is in the development of the personality disorders that become more obvious by adulthood. Now, the risk for these personality disorders is highest among people who developed conduct disorder by adolescence. And because, as I've said, there may be a somewhat greater risk for males with ADHD to have conduct disorder, there may be a greater risk for males to go on to have antisocial personality disorder as well. But we also find that in both sexes of adults, there is a greater proneness for borderline personality and passive-aggressive disorder, though there is some research that shows a slight bias that females may be more likely to have borderline personality, or at least be more likely to be diagnosed with it than are males, who are more likely to have the antisocial personality. It's not clear that there's any sex differences in adulthood in passive-aggressive personality disorder. Now, I want to emphasize that these personality disorders occur in less than about 25% of adults with ADHD, so we're not talking about the majority of adults with the disorder. But where they do develop, there might be some sex differences between men and women. Now, are there any differences in the etiologies or causes of ADHD in children and adults? The answer is largely no. We see the same pattern, and that is that the majority of causes of ADHD fall in the realm of genetics, and specifically the genetics of brain development. There was some evidence earlier in research that girls may be more likely to show a genetically predisposed form of the disorder. In those studies, up to 90% of girls appeared to have an inherited form of disorder, as judged by the fact that ADHD was more common among their relatives. Instead, boys with ADHD, which also show the genetic form of the disorder primarily, but somewhat more boys than girls were more likely to show a disorder that appeared to arise as a result of prenatal and postnatal injuries to the developing brain, such as from pregnancy complications, from premature delivery, from lead poisoning, or head injury after birth. Now, lately, we've not been able to show much evidence supporting these earlier findings, but I want to emphasize it still could be the case. But largely what we see in both sexes is a striking genetic predisposition to ADHD. Indeed, ADHD in adults is one of the most genetically predisposed disorders in psychiatry, being rivaled primarily by autism spectrum disorder and by bipolar disorder. Now, earlier research suggested that for a girl to develop ADHD, it seemed that she needed to have more relatives diagnosed with the disorder before it posed a risk for her, compared to boys who had ADHD, who also had relatives with the disorder, but not necessarily as many. This suggested that the number of genes that predispose to ADHD might needed to have been more for a girl to show the disorder than for a boy. Again, more recent and large population studies using entire genome-wide scans have not necessarily found these sex differences. So we need more research on this issue. We certainly know that clinic-referred girls often have a more severe form of ADHD than boys seen in clinics. But we don't see this when we go out and do general population studies. There we find that girls and boys, and men and women especially, who have ADHD have similar levels of severity. So this might simply reflect what is known as a referral bias. It takes more disruptive behavior for a girl to get referred to a clinic than a boy for some reason. And therefore the girls showing up in clinics, at least in earlier decades, had a more severe type of disorder. But that could be changing because we're seeing that the general clinical professional audience out there has become more aware that girls and women can have ADHD, and therefore more girls and women are being referred and identified with the disorder. And that could lead to the fact that if we were to repeat these studies now, we might find that even in clinical samples, men and women with ADHD have the same level of severity. But that wasn't always the case in earlier decades, where that referral bias was evident. When we look at school and educational functioning in general, we find that both sexes, by adulthood, were equally impaired in acquiring academic achievement skills and knowledge. Both were equally as likely to suffer from learning disabilities in adulthood, even if the males were somewhat more prone to having such disabilities in childhood. We also find that by adulthood, men and women with ADHD attain a lot less education than the typical population, and there's little, if any, evidence that they differ in terms of how much education they get. Now, as I've said, there's a lot of evidence that males in general, and so males with ADHD, are more prone to show disruptive and aggressive behavior and more general rule-breaking behavior in school than do girls with ADHD, particularly when we rely on teacher reports. But as I've said, if we go into the classroom or onto the playground and observe these boys and girls, those differences become smaller and often not significant. That is to say, the girls may be as disruptive as the boys. We do seem to see that boys and girls are much more likely to quit school before completing their education than we see in the general population. And there may be a slightly greater male bias for quitting school, but that may have to do with the male bias for developing aggressive behavior and conduct disorder, which we know are predictors of not completing school, of dropping out, so to speak. So there might be somewhat more males dropping out than females. But again, I want to emphasize the differences are small in most longitudinal studies. Females may be slightly more likely to show impairment in peer social relationships, particularly as reported by parents and teachers. But again, if we go in and do objective observations of their peer interactions, the girls are as impaired as the boys. Or to put it another way, the boys are more impaired or as impaired as the girls. Some evidence suggested that in elementary school and adolescence, girls might be more subjected to bullying if they had ADHD than were boys. More recent studies suggest that both sexes are more prone to being bullied, are also more prone to being bullies, and are generally more prone to being victimized by their peers and other adults than are typical children. But some studies do find a slightly greater sex bias, but not always. There are some differences in sexual activity and in intimate partner relationships by adolescents. But again, I want to emphasize that the differences, where they're found, tend to be small. Both sexes start their sexual careers earlier than typical teens do. That is, start having sexual intercourse earlier than others. Both of them are less likely to employ contraceptive methods. Both show shorter lengths of time spent in a single intimate relationship with another individual. And even during that relationship, are more prone to extra relationship or extramarital affairs, if you will. But again, they don't differ between men and women with ADHD. Both are as likely to have conceived a child as a teenager or young adult, and appear to be as likely to have developed sexually transmitted diseases. And we know that people with ADHD are about 4 times more likely to contract a sexually transmitted disease due to their sort of greater risky sexual behavior and less use of contraception. But again, we're not seeing sex differences here in this risk of conceiving a child. We do see that males are more likely to engage in aggression in intimate partner relationships, known as intimate partner violence. And girls have been found to be more likely to be sexually victimized in relationships with others, particularly by older males. So there's some small gender differences or sex differences here. But again, overall, both show a pattern of risky sexual behavior. My own longitudinal study and a few others have suggested that by midlife, females with ADHD seem to be less likely to have married than did males. But if they did marry, both sexes, men and women, reported much greater dissatisfaction in their marriages and appeared to be at somewhat greater risk of divorcing, although that figure is a little less definitive. Girls were more likely to engage in prostitution, we think, by adulthood. But I want to emphasize there's only 1 or 2 studies on this issue, and mainly they were studying prostitutes, where they found that prostitutes were much more likely to have ADHD than did typical individuals who were engaging in this pattern of behavior. To put it another way, obviously females are more prone to engaging in prostitution than males. And females with ADHD may be even more likely to enter that profession than males. But again, it's not well established with enough studies to make it definitive. Now, when we look at other domains of functioning, we find that both sexes by adulthood show the same level of impairment overall when using more global or generalized impairment ratings. Both of them are employed or have difficulties in the employment area to equal amounts, and they are deficient or impaired in the employment setting in numerous ways, such as needing more supervision, taking more sick days off, being fired from a job more often, that is, being dismissed for inappropriate conduct more often. Both sexes show difficulties with managing their finances, such as handling money, using credit cards, taking out loans, repaying debts, and not saving as much as other people do for longer-term expenses or retirement. Both men and women with ADHD have a lot of difficulties driving a motor vehicle. There's some evidence that the males with ADHD are more prone to speeding because of their risk-taking, and they seem to be more prone to road rage, which is the aggressive use of a motor vehicle. That's not to say that women with ADHD don't do those things too. They certainly do. But men may be somewhat more likely, if they have ADHD, to do so. Both sexes, by adulthood, are prone to having more motor vehicle crashes and more severe crashes, and to having more citations on their driving record, and both seem more prone to have had their license suspended. But the risk of speeding specifically and road rage may be somewhat more common in adult men with ADHD than women. As I said earlier, the males are more prone to aggression and therefore are more prone to antisocial or criminal activities than are the women. But again, women with ADHD are more prone to show this than typical women are, just maybe not quite as much as men with ADHD are. Males are more prone to abusing substances than are females. But if we look at their use of legal substances such as tobacco, marijuana, and alcohol, the women are as or more likely to use these substances as men with ADHD, and to do so a lot more than typical adults are likely to do. Now, both sexes in adulthood have shown impairments in their parenting or child-raising capabilities. It may be that this domain is more affected in a female with ADHD because women in many cultures are more likely to opt to stay at home and raise their children, and therefore carry more child care responsibilities than do men. So women with ADHD might report more impairment in their home life and child rearing than men do, but that's largely because such women may well be spending more time engaged in those activities than do men. Should men opt to be the stay-at-home caregiver, we will see that their parenting is also impaired as well. As I've mentioned, both sexes with ADHD are highly prone to adverse health outcomes, such as impulsive eating, poor diet, obesity, a growing risk for coronary heart disease, and possibly stroke, a growing risk for cancers, perhaps, due to their greater use of substances that predispose to cancer. We also see that both sexes have the same reduction in life expectancy, which is to say, a similar increase in early mortality, though again, it may be somewhat more likely due to accidents and risk-taking in males with ADHD, and somewhat more prone to suicide in females with ADHD. But both show a pattern of unhealthy behavior that is likely to lead to an estimated lower level of life expectancy. So again, I want to emphasize that where sex differences may have been found here, they tend to be small and inconsistent, and overall, men and women with ADHD show very similar levels of overall impairment. Now, the management of adult ADHD is exactly the same for men and women. We really don't change the major components of our treatment package. And in other lectures, you may have heard me talk about these being the 5 components for treating adults with ADHD. The first is, after diagnosis, educating them about their ADHD so they have a better understanding of it and the risks that it poses to them if it's not managed. The second thing we do is to encourage acceptance and compassion on the part of caregivers and loved ones, and even forgiveness for the person with ADHD because they didn't choose to have this disorder. It's largely genetic and neurological in origins. And we also encourage the adults with ADHD to adopt a similar attitude toward themselves, accepting their disorder, owning it, showing more compassion for themselves, and more forgiveness for the mistakes that they may make. We also like to use medications with at least 70 to 80% or more of adults with ADHD, because the ADHD medications are the most effective component of all of these components in the treatment package. But we certainly are going to work with ADHD adults around trying to modify their symptoms and executive deficits to some extent, such as through using the newly developed and specialized cognitive behavior therapies for adults with ADHD that target their executive deficits specifically, such as their working memory problems, self-motivation problems, and time management problems, which are just as problematic in females as males, and vice versa. We may also be teaching them mindfulness, meditation-based practices, although the evidence for that remains at this point largely promising but not definitive. But certainly cognitive behavior therapy, as well as adult ADHD coaching, are equally as effective and equally as necessary for women with ADHD as with men. Finally, we recommend making changes to the physical environment, to the workplace, and to the tasks that adults have to do for both men and women. And by making those alterations, we make it more likely that they can be successful in those environments, that is, less impaired. So accommodations don't change the disorder. They change the environment so the disorder is not as impairing as it would be in others. But overall, the treatment packages are largely the same. Now, where there may be some sex differences in treating women with ADHD may have to do with the sex differences I mentioned that go all the way back to childhood or adolescence, such as the growing risk for anxiety disorders, depression, borderline personality, self-harm and self-cutting, possibly hoarding and obsessive-compulsive behavior, that women with ADHD may be somewhat more prone to develop than men with ADHD do. Obviously, if that happens, we're going to have to add additional treatments to target those comorbid disorders that we wouldn't necessarily have to add for men with ADHD who aren't developing these disorders and who may, arguably, be more likely to be having antisocial behavior and substance use disorders. And for them, we might therefore need to be adding those treatment components for those disorders into the treatment package. I've already mentioned that we may need to manage ADHD symptoms, and particularly emotional dysregulation, differently in females than males at around the times of their life and times of the month where there may be hormonal imbalances taking place. And these hormonal imbalances, at least to date, appear to result in some exacerbation of their symptoms, greater dysphoria and mood symptoms as well, and more difficulties with emotion regulation. So it's possible that around these times, when the symptoms are being exacerbated by these hormonal changes, changes in ADHD medications may be necessary, or more likely, simply adding in additional medications to handle these emotional and mood problems, just for those times when the hormones are exacerbating these symptoms. And then, of course, withdrawing those treatments when they're no longer needed. So let's leave open the possibility that females with ADHD are going to need more episodic changes to their treatment plan to help deal with these hormonally driven exacerbations in their symptoms. Finally, in adults with ADHD, we may need to alter our treatments for men and women depending upon the societal roles they have chosen for themselves. And I've already mentioned this. If women are more likely to stay at home after their children are born and to engage in the child care role, they may report more impairment in those roles and may need more assistance in dealing with those impairments than might a male who has opted to work outside the home and have less involvement in the child care role. And of course, where men and women reverse these roles and women work more outside the home, they're going to report more impairment in their occupational functioning, and therefore they may need more assistance with those impairments in that domain than might a male who chooses to stay at home or work part-time. But again, let's emphasize that the gender differences or sex differences we're describing here tend to be relatively minor, obvious, and predictable from the sex differences that occur even between typical men and women who don't have ADHD. I hope then that you found this lecture to be informative on the potential sex differences that we see across the lifespan between males and females with ADHD. But the overall lesson here is that where these differences are found, they're relatively minor, and both sexes that have ADHD are much more prone to not only ADHD and equal severity of ADHD, but to comorbid disorders and to impairments in nearly every major domain of life activity. Thank you for joining me for this lecture. I hope that you found it informative. Good day.